that, I pushed the wrong button. My apologies. How are you?
I'm doing good. How are you?
I'm doing well, thank you. Doing well. Little fallout today. I've been noticing up there on Capitol Hill. Lots of finger pointing going on over healthcare, huh?
As you would expect, yes.
Yeah. So immediately the speaker said that this is, we're stuck with Obamacare. It's the law of the land. And then this weekend, all I've heard are Jim Jordan and other people coming out saying, "Wait a minute, we need to take another run at this." Is that in the works already, or was Ryan just bluffing?
Well, I don't think it's an either or. I'm not sure it's binary. I think that there are Republicans and others who want to try and do what they can when it comes to the Affordable Care Act. Now, Jim Jordan, these Freedom Caucus guys are much more inclined to pass a simple repeal bill, right? The same kind of measure that House Republicans passed 50 or 60 times when they knew it had absolutely no chance of being effective, and they would like that to go forward. That's not really what Republican leadership, President Trump, has gotten behind. They've said that there needs to be a repeal and replacement, and the holdup continues to be what that replacement looks like. So I think it's entirely possible that you see legislation continue to be introduced and even considered, but I'm not sure what the coalition necessarily looks like. And interestingly enough, we've heard now from President Trump and his chief of staff, Sir Reince Priebus, who have suggested maybe we go to moderate Democrats to see what can be done.
I've seen several Democrats today saying that they didn't have a whole lot of interest in that yet. My take on this, Jared, and please tell me if your reporting is different. My take on it is the Freedom Caucus went to President Trump. They got some. They got him to cave in on a couple of things and add things like removal of the essential benefits from Obamacare, things like that weren't going to be there. And then they went back again and asked for some additional things like removing the guarantee of coverage if you've been sick. And that's when some of the more moderate Republicans, I guess that's a good term to use, started getting cold feet at that point. Is that correct?
Yeah, I mean, so the counter to the Freedom Caucus, which is a group of conservative Republicans, is a group called the Tuesday Group here on Capitol Hill. That's like Charlie Dent and some other more moderate, as you would say, Republicans. Usually, and by moderate, generally it's because they're from more swing-type states, swing-type districts, potentially districts that the president did not win. And so you're right. As concessions were made to bring in conservatives, the trouble that then Republican leadership had was it was eroding some of the support from these other groups, from moderate groups, and who were spooked as well, by the way, from that CBO report that said 24 million people could potentially lose health insurance. So it really seemed like a difficult needle to thread, to try and find that sweet spot.
Yeah, that's why I wondered when I heard...
Particularly when you have a pretty small margin for error given the Republican majority, and that Democrats had already told Republicans if the aim is to get rid of the Affordable Care Act, then you're on your own. Now, you fast forward to Sunday, Democratic leader Chuck Schumer was on one of the Sunday shows, maybe ABC this week, and said, if the idea is to improve Obamacare, we'll do that, but we're not going to go along with a plan, he said, to repeal or undermine the law. And I think that maybe is where you hear now from different lawmakers from both parties about, why the next step may not be may not look like what we just went through.
Yeah. Did I also heard some reporting this weekend that from a variety of news outlets that this may somehow hamper the Republicans' ability to move forward on tax reform?
Well, tax reform was always going to be difficult. The last time, I guess, there was really meaningful sort of what they're looking to do kind of reform of the tax code was like 1986, right?
Right.
So it's never easy. And I think the reason that you're hearing some of that talk about, are they going to be able to do it, is because healthcare was viewed as the easier of those two things to do, given the Republican-controlled government, right? That Republicans are now the governing party in both chambers of Congress and the White House, and that there is still trouble in sort of getting everybody on board with one kind of plan.
Yeah, I
think that's what it's more about, right? Now there was also within this repeal and replace measure some tax stuff that I guess was sort of going to make the broader tax reform a little bit easier, but I think there was always a thought that, what will tax reform look like? What will it mean? Are you going to be able to get buy-in from Democrats? If not, will Republicans be able to marshal the votes necessary? Sort of similar to what we just saw with the health care bill.
Do you think we'll continue to see a bill submitted by House Republicans, and whether the Freedom Caucus members or not, to try to move this forward?
With health care?
Yeah.
I think you're really seeing a movement from President Trump and others that they're going to try and move forward on tax reform here in the spring.
Interesting. All right, good.
I think that's what the focus, at least right now, is.
Right. Jared Halpern, Fox News Radio, thanks for your time.
All right.
All right, thanks for your input. I appreciate that, Jared. Thank you. So there you have it. He thinks that they may not revisit health care for a while, which really surprises me. I assumed, maybe I'm wrong. And by the way, I did want to mention, George, I'm sorry that you got cut off. Please feel free to call back here. The phone number is 314-969-9797. I did inadvertently cut George off when I was trying to get back to Jared's phone call, and I apologize for that. I'll get to your phone calls here in a minute. My assumption, in as I read the political read on this, is that Donald Trump is basically saying, I'm going to take my ball and go over and play with the Democrats if you don't give me what I want here on health care. I don't know if that's going to work in this environment or not, because the Democrats aren't going to play ball if it has anything to do with eliminating Obamacare. They've said they want him to work with them on ways to improve Obamacare. There's much you could do to improve this situation, as long as you're mandating the things that you're mandating and forcing premiums to rise at the rate that they're rising. Even with the mandate that was supposed to save this boondoggle, the costs are still out of control. And, I heard someone this weekend will go unnamed, a neighbor, mention that, well, it's too late. It's too late to get rid of Obamacare. Too many people have it, and it would just ruin the whole system if we got rid of it. Well, no, it's not. We need to get rid of it. But we may not be able to get rid of all of it if you consider part of that to be the coverage for existing illnesses, or the kids living in your basement till 26 can be covered by your health care. Those may be things that have become popular enough, even with some Republicans, that they're not willing to put those in a bill, so that no matter what you do, at the end of the day, you can't say you've repealed 100% of Obamacare. But what you have done is you've gotten rid of $300 billion in tax increases. That's big. You've gotten rid of a government-down healthcare system that forces you to buy health insurance or fines you $2,500 if you're without it for even 30 days. And that's not something that this economy can take for sure, and it's certainly not something that most people can take unless you don't work, and then it's subsidized, and it seems like a great deal to you, right? That's kind of where the rubber hits the road on this. I'll continue to take your phone calls on it, because it's going to continue to be an issue until it gets dealt with. And we need our legislators, and certainly Congresswoman Ann Wagner seemed to be on board with this when I saw her on Saturday night, and Senator Blunt seemed to be on board with it. We need them to get the message that we need to get rid of this thing while we can before it gets any worse. Rachel Bovard from the Heritage Foundation is going to call me here in a couple of minutes, and we're going to chat with her about what this looked like and whether there's a chance to salvage it to the satisfaction of enough people that we can actually get it through the House of Representatives and the Senate. I'll get to her. I'll get to your phone calls all coming up. And I'm told we do have Adam Shapiro from the Fox News Channel talking about this